Hi everyone, welcome to my first video on preventive health and health maintenance for the USMLE Step to CK. I chose this topic because this is something that I struggled to find a good resource for during my prep and something that was really heavily tested on my exam. So what we're going to do in the next couple of videos is that we'll take a look at a question and then discuss what you need to know to answer that question correctly. Alright, so with that, let's go to our first question. So, you have a 35-year-old male who is in your office for routine medical checkup. He has no complaints. His vitals are normal. His physical exam is normal. He has had his annual flu shot. He had a lipid screen at age 17, which was normal. He has no significant past medical or any significant family history. What do you do next? Do you want to screen him yearly for hypertension? Do you want to measure his fingerstick blood glucose levels now? Do you want to measure his lipid levels, measure CRP, or order an EKG? Now you can hit pause and take a minute to think about the question and write your answer in the comment below. Right? And okay, now we'll discuss how you need to approach questions like these. So whenever you have a completely healthy and asymptomatic patient, I want you to think about what steps you can take to screen him for any potential diseases, or how you can prevent disease in this patient. So, what are the common diseases that you screen for? One would be cancer, and you can screen for maybe infection. You can screen for cardiovascular diseases or any psychosocial problems that a person might have. I've talked about each of them separately in my subsequent videos. So, cancer. Now, he's too young to have cancer. You typically would screen for cancer in patients more than around 50 years of age. Infections, you can screen for STDs in patients who have risk factors. He has no such thing. Or you would think about taking an immunization history of a child or an immunocompromised person. CVS, you can certainly screen this patient for cardiovascular health, and that seems to be where our answers are leading us to. So, what all diseases, cardiovascular diseases, do you typically screen for? You can screen a patient for hypertension. Ideally, every patient should have his blood pressure taken at every physician visit. Our patient had that. But what do the guidelines say for repeat testing? Now, if you have a patient who is less than 40 years old and has no risk factors for any cardiovascular disease, it would be safe to screen him every 3 to 5 years. But if he was more than 40 years old or had risk factors like a strong family history, obesity, hypertension, or diabetes, then you would want to do an yearly exam, an yearly BP monitoring for that patient, like the first option said, but not this patient. Now, the other thing you can do is screen him for diabetes mellitus, and let's take a look at what the current guidelines say on this topic. Now, this is the United States Preventive Services Task Force recommendation, which says that you should screen for diabetes in adults which more than 40 to 70 years of age if they are overweight or obese. Now, on similar lines, you have the recommendation of the ADA, which recommends 3 yearly screening starting from age 45. You would start screening earlier if your patient had a BMI more than 25 or any other risk factors for cardiovascular disease, but not this patient. So this patient does not seem to be the right candidate. Also, the option says to screen him with fingerstick blood glucose measurement, which is not the right answer, because you have to screen a patient with a fasting glucose level and he's clearly not fasting when he's coming to your office in the afternoon. So that is definitely not the correct answer. Now, the third thing I want you to think about is whether or not this patient should get a lipid screen at this point. Now, before we look at the options, I want you to notice something interesting about the vignette. Now, this patient already has had a lipid screen at 17 years of age. Now, why did he get that? Now, what I want you to know is that there are mainly two populations that we screen for lipid disorders, and we do it for very different reasons. One would be the children and adolescents, and they get a lipid screen to find out if they might have a familial dyslipidemia. Whereas the other group is adults more than 35 to 40 years of age who get a lipid screen as a part of their cardiovascular disease risk assessment. Now, let's take a minute to look at the guidelines for these populations. Now, this is the US Preventive Services Task Force recommendation, which says that currently we do not have sufficient evidence to assess the harms and benefits for screening in children and adolescents. However, there are other associations such as the AAP, which recommends for screening in ages 9 to 11 years, and then once again after puberty in 17 to 21 years. For the purpose of the exam, you should just remember that it's alright to screen people in these age groups. However, you do not want to screen anyone between ages 12 to 16 because they might have a deranged lipid profile, and it's absolutely physiological for them to have so during puberty, and you do not want to follow it up further. Now let's look at the guidelines for adults. Okay, yeah, here's it. Now this is an older version of the US Task Force recommendation 2012, which at that time strongly recommended screening men more than 35 and women more than 45 for CAD using a lipid profile, and even starting at a younger age if they had risk factors for this. However, there's been a recent update to it in 2017, which said that they have insufficient evidence to recommend screening or treating for dyslipidemia before 40 years of age. So, and at the same time, you have a number of other guidelines such as from the ATP and the AHA, which recommends screening starting 35 to 40 years or sometimes even at 20 years of age. So the bottom line for this is that you have to use your clinical judgment. However, it's not a wrong answer on the exam. Now let's go back to our whiteboard and talk about what you will do if you actually screen this person. Now, you get a screen and the person has absolutely normal lipid profile. Well and good. What you would do next, you would just send him home and screen him again after 4 to 6 years. Clear enough? But in case he has an abnormal profile, what do you do next? Number one, I want you to remember that this patient, he got his lipid profile done in a non-fasting state, and that is okay for screening. Why so? Because for screening, what we basically need to measure is the non-HDL cholesterol, which includes LDL, which is what is correlated with your risk of cardiovascular disease. Now, if you remember this equation, we can measure your total cholesterol in a lab, we can measure the HDL, then there's the LDL, which we cannot measure routinely, and then there's the VLDL, which is equal to your triglycerides by 5. This is also something we can measure in the lab. Now, the non-HDL cholesterol is nothing but this, right? And the only thing affected by your fasting or non-fasting state is the triglycerides. And since this patient already has had a baseline lipid profile which was normal, it would be perfectly alright to just screen him in a non-fasting state, provided he gets a normal result. However, if his non-HDL cholesterol was high, then in that case you would definitely want to get a confirmatory fasting lipid profile, just so that the results are not confounded by a high triglyceride. Okay? And what else would you want to do in that patient? The next thing you would want to do that in case he has an abnormal confirmatory test is calculate his risk for CAD, because that was why we screened him in the first place. Now, had he been more than 40 years of age, our task would have been simpler, because there are well-validated calculators for that, which recommend the next step according to his risk of CAD, which I've talked about in detail in a separate video. However, they're not validated for anybody less than 35. So what you would broadly do is just make an informal assessment of his CAD risk and then act accordingly. This step is definitely beyond the scope of the board, so you don't need to know that. However, what you would want to definitely do is follow him up more frequently and maybe suggest lifestyle changes and see where that goes. Okay, now let's go back to our question and see what we have ruled out or so far. Right, so we are not doing this. This is the wrong option. This seems alright for right now. And how about this? Now this is a very common distractor. This lies in the broad category of non-traditional cardiovascular risk factors, which also include your ankle brachial index as well as your coronary artery calcium score. Now these are always wrong answers on the test, because we only use them after we have established the CAD risk using the traditional factors, and in case the results of that assessment are equivocal. That is the only population we would use these tests in, and not routinely. And as for ordering an EKG, it has absolutely no utility for predicting CAD in a patient without any signs of chest pain, whether or not he had risk factors for cardiovascular disease. So that is also definitely the wrong answer. So I think we have narrowed down our right answer here, which may not probably be the perfect answer, but it's the best among these options. And I think this is what is more important. This is the important thing. And so let me just take this moment to also discuss what other options, what other answers could be reasonable in such a scenario. Like I talked about, psychosocial screening is not such a bad idea in this patient. For instance, you could do a quick depression screen. You could ask him about his alcohol, tobacco, and drug use and make appropriate recommendations, mainly because it does no harm and it's cheap and easy to administer. Now, I think that's all about the question. I hope you found it useful, and please feel free to leave any comments or suggestions, or in case there's any topic or question you would like me to discuss, feel free to tell me that and I would try to address it. Thanks for watching.